like anatomy of the neck, because these are the vital structures in the neck which needs to be elaborated and discussed. For example, the compression of neck, whether partial or complete, it obstructs the blood flow as well as breathing. यानी चूँकि दो इम्पॉर्टेंट स्ट्रक्चर हैं, ना सिर्फ खून का बहाव, वेन्स हैं, आर्टरीज हैं, नर्व्स हैं और विंड पाइप है जो एयर कंडक्ट करता है. तो प्रेशर ऑन दी स्ट्रक्चर्स, इन चीज़ों पे दबाव मुख्तलिफ़ किस्म का वेट मुख्तलिफ़ काम सर अंजाम देगा. So compression of neck, whether partial or complete, will either obstruct the blood flow or the breathing. For example, the most susceptible structure, जो सबसे नाजुक है, they are the carotid bodies. In the carotid sinus, at the carotid vessels, there are the receptors which are stimulated just by pressure, by slab or slight compression, and this will initiate excitation of the vagus nerve. And the vagus nerve, when it is initiated, it immediately precipitates cardiac arrest. Then there are veins, the venous return. You can see in the picture there are venous complexes which are draining blood from the head and neck towards the heart. And when there is compression which occludes the flow of blood in the veins, it causes congestion and even hemorrhages above the level of constriction. दबाव से ऊपर वो जो प्रेशर बढ़ेगा तो वहाँ पे congestion और hemorrhages होंगे. These are the diagrammatic representation. In the lateral view, you can see the junction of carotid artery, external and internal. There are the carotid bodies and vagus nerve is shown. Similarly, on the right side is the picture which is showing the windpipe. In the center, trachea, the thyroid cartilage, the hyoid bone, and on the sides there are the vessels which are the carotid vessels. Then this diagram is showing the carotid vessels. Obstruction to the arterial supply of carotid artery will lead to anoxia to the brain. The blood supply to the brain is interfered with and it will cause anoxia. Then we know that there are other vessels which are vertebral vessels. They are running into the vertebral foramina and they are also supplying blood to the brain partially, and their obstruction or their occlusion will need much more force to prevent that flow. And this is the windpipe showing the trachea, and obstruction to the windpipe causes generalized oxygen deficiency, and to produce this compression, sufficient pressure is required to stop the blood flow, because the trachea is a rigid structure made of cartilage, and to occlude them needs much higher pressure. Usually what is done, basically the larynx is lifted up and back, so it forces the tongue backward and upward against the posterior pharyngeal wall. So the inflow of blood from the nose and mouth which is going into the trachea in the hypopharynx, that is occluded. So larynx is lifted up, it pushes the base of the tongue against the posterior pharyngeal wall, and that occludes the inflow of the air. So what happens with the effect of pressure on the neck? The slight pressure on the carotid sinus will cause the vagus nerve stimulation and cardiac arrest. And when the jugular veins are blocked, there will be congestion and hemorrhages. And with carotid artery blockage, it will cause unconsciousness. And when the airways are blocked, it will cause hypoxia or oxygen lack. And when the vertebral arteries are blocked, the arterial supply to the brain stops. So what happens and how much tension or weight is required to occlude these structures? Jugular vein just need 2 kg or 4.4 pounds of tension to occlude them. Similarly, the carotid artery needs only the 5 kg or 11 pounds. And trachea compression needs 15 kg or 33 pounds. And vertebral arteries approximately 30 kg, between 20 to 40 kg, that is 66 pounds. So this much pressure is required to occlude these structures. So when this force is applied up to this level, these structures are compressed. Then the least tension is needed to occlude the next structure, that is 5 to 10 kg, is sufficient to occlude the veins and the arteries. And the greatest tension which is required, that is 50 to 40 kg. So minimum tension, that is 5 to 10 kg, and maximum tension 20 to 40 kg. And when the hanging or the suspension of body occurs, body weight is much higher than 20 kg or 40 kg. So it occludes all the structures.